welcome to our second session of the Community Connections 2013 Proposal Reviewer Training. My name is Christine Mulvin, and I'm the Program Officer for HealthPath. With me in the room is Tara Buchanan, our coordinator. She's the one you've been emailing and may have been emailing and sending proposals into and asking questions of. And she's going to be helping me sort of coordinate the webinar and make sure I don't miss any questions in the box. So at any time, please feel free to type a question in to the question box on your screen. And if you have questions afterwards, after the webinar, or as you start reviewing proposals, please feel free to call or email me at any time and ask those questions. There we go. First, I want to give you a little bit of information about the HealthPath Foundation of Ohio, talk a little bit about the invited proposals and topics around increasing access to care that we're looking at funding this year. I want to talk to you about the funding process and how we're going to make the decisions, go through the scoring rubric that we'll be using this year, and then finally just take questions and answers. And again, at any time during this presentation, feel free to ask a question. HealthPath was started back in 1999 as the Anthem Foundation of Ohio, and at that time we chose two focus areas. One was the prevention of family violence, which we funded through Community Connections last year, and the other was preventive oral health. We added a third area in 2011 called Strengthening Ohio's Safety Net, or SOS Net. And both the preventive oral health and SOS Net are the focus of this year's Community Connections grant. We've awarded $14 million in grants to date since '99, and over half of that has been through the preventive oral health focus area. Dental care continues to be the single #1 unmet health need in Ohio, and cavities are the most common childhood chronic disease. About 5 times more kids have cavities than have asthma. So it's a very serious chronic disease, both among children and among adults. Some of the things we've done since '99 in preventive oral health are on your screen. In particular, we helped start up some safety net dental clinics and also helped those clinics build capacity through our oral health capacity building project, where we just helped them get the skills and materials and resources they needed, not only to start their clinics, but also keep them going. In SOS Net, we've invested just under $1 million, but again, it's only about 2 years old. And the things we're really going to focus on in SOS Net are supply and demand of providers. The providers in Ohio are geographically now distributed, so they're not always in places where people need them to be. People may have a long drive to get to dental and safety net providers, or the providers in their area may not accept sliding scale fee patients or Medicaid and Medicare patients. So it's figuring out how to distribute the doctors and recruit and retain doctors in areas that have typically been more difficult to do that in. We're doing that through 2 things. Number 1, access to capital, so helping safety net providers get access to the money, financing, and resources they need to build buildings and equip their centers and address technology issues, and then also increasing the primary care workforce. Our geographic service area was set up by the Attorney General when HealthPath started. You can see it's a little weird. We cover the east and west side of the state, and there's a T across the north and down the middle that we do not fund in. That's not to say that we wouldn't fund a statewide project or that we wouldn't fund a organization that resides in one of the counties, one of those white counties, but the bulk of our money has to serve the people in those 36 orange counties at the outside of the state. And interestingly, 24 of our 36 counties are Appalachian designated. So we cover a lot of rural counties, and we cover a lot of Appalachian counties in Ohio. The Community Connections program is offering grants of up to $5,000. This year we added a challenge grant option, so applicants could apply for a regular grant of up to $5,000 and a challenge grant that would give them a $2,500 one-to-one match, which would give them a total of $10,000 for their project, $7,500 from us and $2,500 in a match. Last year, as I said, we did family violence prevention, and this year we're looking at increasing access to care. Our process for Community Connections, we always do a letter of intent, and the HealthPath staff review those and invite people to submit full proposals. The full proposals are reviewed by our external volunteer grant proposal readers. That would be all of you. And we award the grants in November after the board has reviewed the recommendations from the external reviewers. And we celebrate with a grantee recognition luncheon and evaluation workshop, yay, that will be held at the end of November. So not only do we celebrate the grantees getting their awards, we're also this year going to honor some of our legacy partners in preventive oral health, some of the people and organizations that we worked with for years, and then have an evaluation workshop. So this year's grantees can learn how we are going to be looking at the results from these grants. The timeline, we started back in April with the pre-application workshops. Letters of intent were due on May 31st. Full proposals were due on August 2nd. We will have those proposals out to you by August 23rd. Our plan is to drop them in the mail this Friday, so that should give about a week to get to you. And the people in Hamilton County, Dayton area will probably get them by Monday or Tuesday. The people in the further reaches, it may take a couple more days, but you should have them by Friday, August 23rd. Our in-person team review meetings will start September 16th. That'll give everyone about 6 weeks to review the proposals. No one reviewer will have more than 6 proposals, so you don't have that many to do. And they're also only about 4 or 5 pages long, I think, not counting any letters of commitment that they might have included. So about 6 proposals per person, and they're not very long either. After the review meetings end around October 1st, the HealthPath staff will tally the results, make recommendations to our board, who meets in early November, and we will notify the grantees on November 8th whether or not they receive funding. A little bit about our invited proposals. We received 55 letters of intent. We invited 51 organizations to submit proposals. 1 organization dropped out of the process, and so actually 2 actually have dropped out. One of them just dropped out this afternoon, so we found out. So we have 49 proposals that we received, and these cover 33 of our 36 counties. Some of the barriers to care that the proposals are looking at, the top 2 are no access to other health services such as behavioral health care, oral health care, and specialty services, or that patients can't get to services. There may be transportation problems. There may be time of day issues. You know, a lot of doctors' offices are open while people are at work, or pediatricians' offices are open while kids are at school. So helping patients get to the services they need. Children's access was also was third, tied with language and cultural issues. This is a map of all of our counties and the grants that serve them. The bigger brown circles are grants that will only be available in a single county, or that will only serve a single county. The red circles and then the smaller red circles indicate the grants that cover multiple counties. And yes, this PowerPoint presentation will be available on the website. As well as, I'll post the slides themselves, as well as the recording of this session. So here's our map. You can see we have pretty good geographic spread. Hamilton County had a number of submissions, and so we actually have 3 proposal teams that are going to review those Hamilton County grants, so that again, no no one person has more than about 6 proposals. On the west side of the state, we have 7 regions. We've got one up around the Lima area, one around Dayton, one that covers southwest Ohio, counties of Butler, Warren, and Claremont, one that handles the south of the state. We have 2 that cover Hamilton County organizations, and we have one, for lack of a better name, it's called Southwest Multi. So those are Hamilton County-based organizations that serve a number of counties in the Southwest. On the eastern side of the state, we have 3 regions, the Northeast, the East Central, and the Southeast. And I'm working right now on trying to get meeting times out to people to schedule these meetings. Because of the distance from me to the east side of the state, I'm trying to schedule those 3 meetings first so that I can drive out there once, hit all 3 groups, and come on home. So as soon as I get them locked in, I will start scheduling the other review groups, because it won't take me as long to get to the other regions on the east side as it does for me, or on the west side, as it does for me to get to the east side. All right, increasing access to care. Community Connections this year wanted to address barriers to accessing care. The ACA is coming online in October. The insurance exchanges will be out. That will help address some of the barriers to care, but a lot of people, even though they have insurance, may not have a place to go to get that care. So how can we address some of those barriers? We also want to strengthen healthcare services to the most vulnerable people in Ohio and connect people in general to healthcare services across the state. As I said before, our access to other health services, which was one of our most popular requests, is people may have primary care, but they don't have mental or behavioral health care. They may not have oral, vision, or hearing care, and other types of care that they need besides primary care. It may be that there are a lack of providers in their area, or that the providers that are there won't accept Medicaid or a sliding fee scale for the uninsured. I already talked a little bit about how patients can't get the services. That was the second most popular topic that proposals wanted to address. Children don't have access. Sometimes there's a lack of pediatricians, especially for other health services such as dental care. Sometimes it's a lack of providers who will see Medicaid or sliding fee scale patients. And then sometimes it's hours of operation. It's hard to get a kid to the doctor when they're at school. Some language and cultural issues include having bilingual staff. It might also be translation of in-person conversations or printed materials, and then cultural competency around not only foreign cultures or immigrant cultures, but also some cultures within the United States. People don't have insurance. That was one of the, I guess, medium topics that some people were very interested in. Many studies have shown that if you do not have a payer source, you're less likely to get health care services. And there are some Medicaid eligible people right now who aren't aware that they are eligible for Medicaid. And once the insurance exchanges come up online and the subsidies, the tax credits and the subsidies come into place, there's going to be people who can benefit from those things but won't know that they can. So a number of the proposals will deal with how do you help people connect to those new insurance options that will be available. One thing that the SOSNet initiative does, and that Community Connections will also do, is to help with the provider and workforce question, helping supply meet demand in certain areas, including around bilingual staff, and then also some licensure and credential issues that may be in place. In order to provide care to people, sometimes providers just need equipment. They might need basic supplies for expanding to new services. For example, a couple of the proposals will look at bringing dental sealants into primary care And in order to do that, there are some basic supplies that you might need. Other proposals are looking at replacing outdated equipment, so making sure that the things that they have can help provide the best care, and in a lot of cases, more efficient care because of the new technology. So our funding process is there's 3 steps. First one is to have our proposal review team look at the proposals, we'll score and discuss them and make recommendations to our board, or to the HealthPath staff. And the HealthPath staff, which there are 3 of us, will look at the proposal review team recommendations, look at our own analysis of the proposals, and make final recommendations to our board. The board will then review those and make final funding decisions on November 1st at their board meeting. HealthPath wants to make sure that we're making a difference in the community and that the projects that we invest in are viable. We also need to exercise due diligence in reviewing proposals and being good stewards of the Foundation's funds. So if there is a proposal that the review committee does not think will succeed, we may not fund it, even if we had the funds, even if we had enough money to fund all 49 of our proposals. We may not fund all of them if they won't do good work in the community, or if there's a chance that they may not succeed. So that is our focus, is to make sure that we are really investing in projects that can help us achieve our mission and that will help the communities that we serve. The proposal review teams have 2 opportunities to provide input. The first is through individual scoring, and the second is through a group discussion. So starting September 16th, the panels will get together in person, and we will look at everyone's individual scores and then talk about some of the issues related to the proposals. And then from that, we'll develop recommendations for funding. So we won't just base it on the scores of the proposals. The highest scoring proposals may not be funded. The lowest scoring proposals may be funded. We're going to take both the group discussion and the individual scores into account. Each reviewer will have no more than 6 proposals, and we're not asking you to rank them against each other or compare them to each other. We want you to score each proposal on its own individual merits. During the group discussion, we'll talk with the other people on the team. These meetings will be no more than 3 hours long. Last year, I think they were about 2.5 to 3 hours, and the reviewers had about 10 proposals per person. So I think this year they'll be a little bit shorter. I'm also going to try my best not to schedule any of the review meetings more than an hour from any one reviewer. That may be a little difficult, especially in the more spread out eastern region, especially down for the folks in Washington County and Jefferson in that area, but I will do my best. I will come to you. You do not have to come to me. So it's my circle tour of Ohio, as I like to call it. So as I said, I'll begin scheduling those meetings hopefully next week, getting some dates and times out to people through an email. Each proposal, again, should be considered individually. Your recommendations, group consensus during the panel, and the individual scores will form some recommendations that the HealthPath staff will review, and then we will take those to the board for the final decision. All right. This year we're going to use a slightly different process than we did last year. For those of you who reviewed with us last year, the scoring rubric will look a lot alike, but this year we're going to ask people to submit it before they come to the meeting, as opposed to bringing it. You can still bring it with you to the meeting, but we're going to ask people to submit them before the meeting so that we can compile the scores and take a look at some things before we get to the meeting. The rubric just helps give some structure and consistency to how the proposals are measured. We have people who've never reviewed proposals before, and we have some veteran proposal reviewers. So the rubric will just help get everybody in the same, looking at the same issues and scoring things on the same scale. It also will help streamline the in-person discussions during the proposal review meetings and help you as the reviewers organize your thoughts and comments about the proposal. There are 13 components in the rubric. Those pretty much correspond to the sections of the proposal, and we will include a copy of the proposal guidelines in your packet with the proposal so that you'll have that to refer to. The highest score any proposal can get is 92 points. We are going to normalize those because there's a couple things that are optional, especially around challenge grants, just to make sure that everybody's kind of on a level playing field. And the rubric does include some guidance for you as in terms of how many points to award to each section. Here are the 13 things that the rubric will consider, as well as the maximum point values for it. Sections that are a little bit more important, such as 2A, which is their approach to the project, will be have a couple more points than others. Some that are not nearly as important, such as having all of your letters of commitment in place, have slightly fewer points. The scoring rubric was not provided to the grantees as they were preparing their proposals in terms of how many points each section would be. But when you look at the rubric versus the grant guidelines, the sections are exactly the same. So, and I'll show you in a minute what the rubric actually looks like, and I can hopefully clarify that a little bit more. Reviewers will fill out one rubric for each proposal, and again, submit it before you come to the meeting. We will email you a PDF version, and when you finish the PDF on your computer, if you hit submit, it will send the results to us, so we'll end up getting it in one giant form database. You can also fill them out online, and I will show you that right now. And I'll email you a link to the online form, as well as I'll email the PDF form. So when you come into the rubric, you'll go and you'll pick your name, and I will be Lisa Myers for the sake of demonstration. You will see a list of the proposals that you're given to review. So obviously this is not all 49 proposals. It's only the ones you will receive in your packet. So that will just help us make sure that somebody doesn't click something accidentally. So this is what the rubric looks like. So section 1A, and I want to point at the screen, but I know you can't see me pointing, so just imagine I'm pointing at section 1A, because actually I am. You specify your goal for this project, including the target number or percent increase in access to care for the specific population you are serving. That is word for word the instructions that people were given in the proposal guidelines. And then the point guidance is below that. So if their goal is vaguely defined and does not include the target number or percent increase, you could give them 1 to 3 points. If their goal is very clear and the population experienced the problem is specific, you have that percent increase in there, then you could give them 4 to 6 points. So in each section of the rubric, the people got the first, I'm pointing at the screen again, people got the first section, kind of the instructions of what we wanted to provide, but we did not tell them how we were going to score the proposal at that time. All right, and so you'll go through each section of the proposal and score them. There's also a place not only to include your score, so on a scale of 1 to 9 or 1 to 6, how many points you give them, but also to type some comments and rationale behind that. That's if you want to sort of provide information or type notes to yourself, things like that. I can print these out. So if you submit them through a PDF, you could print it out yourself. If you submit them through the online form, I'm able to print those out, and I can bring those to the meeting with me so that you'll have a copy of what you submitted to us, as well as any other notes you may have. Okay. And as you're going through the rubric, if you have any questions about it at all, please don't hesitate to email or call me and let me know what your questions are. I can help walk you through it. The rubric also, if you do it online, will not let you go to the next page or the next section until you've completed the things on the page. So I want to make sure that we capture scores from everyone for every section. So just a couple examples to kind of show you how people might score some of these, looking specifically at the goal. So we asked people to specify their goal, including the target number of % increase in access to care. Oh, we have another question from, let me answer this real quick before I get to the example. Would you recommend reading the entire proposal, then entering the score in the rubric, or enter the scoring as you go along? My answer to that question is going to be yes. I think it depends on your own personal style of how you like to review it. I personally like to read through the whole thing once before I even think about scoring it, and then read through it again, each section one at a time, and get the score down. Because sometimes I think you might read something in one section, and they talk about something else in another section, and it might match up. So I personally like to read the whole thing before I go back and score individual sections of the proposal. I know last year our reviewers said they spent about 45 minutes per proposal reviewing them on average. I think most people probably spent around 30 minutes maybe. Some of the proposals were a little longer. Some of them, I know last year, plus they had more of them. But last year there were a few that I think were a little tricky to look at, and so it may have taken people a little bit longer to review them. So I would assume about 30 to 45 minutes per proposal is probably about an average. So that, that's probably most people reading the whole thing once and then going back and reading each section individually and then preparing their notes and scores for the proposal. All right, back to our example. So we asked people to specify their goal. So here is an example of a goal. Our goal is to help more people get access to care by helping them sign up for Medicaid. Okay? The second goal. Our goal is to help 250 uninsured Butler County residents get insurance through Medicaid or the exchanges and then link them to providers for care. So as you're looking at these goals, one of them, I think, obviously, does a better job of stating the goal clearly and providing the target number of people that they want to serve. One of the goals specifically says 250 Butler County people. The other one is a little bit more vague. So the one on the left would probably get sort of 1 to 3 points. The one on the right would get somewhere between 4 and 6 points. We also, during the pre-application workshop, we had the nice folks from Health Landscape come and demonstrate mapping. And we wanted to encourage the applicant to include a map in their proposal. And so we have a section in the rubric for map bonus points. If the proposal includes a map, the proposal would get sort of an extra bonus point. And if the map is clearly related to the population that the proposal talks about and helps illustrate it, they get another bonus point. Because sometimes people throw maps in to throw maps in, and it may not make sense or really help illustrate the target population. So we wanted to make sure that we gave people credit for using maps appropriately to help illustrate the people that they're trying to serve. So I've included a couple sample maps here. The first one is for Butler County. We're kind of using the same example from our goal. This is a map that shows the rate of employers who do not offer insurance and the locations of the federally qualified health centers in the area. And remember, the goal of this organization, or this project, was to connect people to insurance. either through the exchanges or Medicaid. The second map is a picture of the percent of uninsured adults in Butler County and the surrounding counties. It does not include the information about federally qualified health centers. And while it does show the percentage of people whose employer does not offer insurance, the focus of the map is really the percent of uninsured people. So if I were looking at this and my target population were uninsured people in Butler County, this second map, I think, does a better job of illustrating the population rather than the previous one, which had the federally qualified health centers, which doesn't make a lot of sense when you're strictly talking about uninsured people. It does talk about where they could go to get care, but the link to insurance is a little harder, I think, to tease out of that. And it also only shows the people whose employer does not offer insurance. That doesn't mean that there aren't additional people who are uninsured or additional issues with receiving insurance. So in this case, the second map would get bonus points, the first one would not. Another section that I wanted to kind of talk about quickly is the required component of the objective. We asked in the proposal for two very specific things in the process objective. So we're not looking for outcome objectives in this case. We're specifically looking at process objectives. We asked the applicants to include both a person responsible for completing the objective and a deadline. And so one objective might be to help 250 Butler County residents enroll in Medicaid or insurance through the exchanges. This one does not have either of those two things I just mentioned. It does not have a person responsible. We don't know who is going to help the Butler County residents enroll in Medicaid, and we also don't know by when they will do it. And those are important things, as I'm sure most objectives. You need to have a who and a when, and it's more likely to be accomplished. The second objective is very specific. By October 30th, 2014, the enrollment specialist will work with 250 Butler County residents on signing up for Medicaid or insurance through the exchanges. So we have a deadline of October 30th, and we have the person responsible being the enrollment specialist. You don't have to include, the proposal does not have to have a person's name. It could have a title. That's acceptable. But it does have to list someone other than the very vague we or no person at all. And then besides just looking at these required components, we're also asking the reviewers to look at the content of the objective to make sure that they make sense in terms of the project. Another thing that we're going to ask you to do is to look at the budget. And we're not asking you to be an accountant. We're not asking you to add up all the numbers. We're not asking you to do any sort of analysis on their budget. We want you to look at it to see if it really just makes sense. Is something missing from it? If they mention adding dental services to like dental sealants to a pediatric primary care clinic, do they have in the budget the materials that they need to do that, the supplies they'll need to do that? So things like that. Are the costs reasonable? And this is where we're going to rely on the geographic knowledge of our reviewers, because you know about what things cost in different parts of the state. A project in Hamilton County will have a different budget than a project out in Marietta, or a project up in Canton, or a project over in Lima. So you can look at the proposals and see, in the context of your county, do these costs seem reasonable? And does it make sense? Do the things that they're looking at in the budget make sense? And the budgets do include not only a table of the budget cost, sort of, expenses and income, but also a narrative. We ask people to talk about what they're going to use the money for. So you'll have both the proposal table, which kind of gives you the top line costs in each of the sections, as well as a narrative where the applicants can talk about how they're going to be spending the money. And finally, I want to talk about the letters of commitment. If an organization includes partners that they're going to be working with in the community, we've asked them to include letters of commitment. These should not be letters of support. We're not looking for, we support this project because it will do very good things in our community. We want to see that the partners understand the financial, in-kind, and access to patients or clients or resources or space that the partners are expected to give. I know last year some of our proposals, the letters of commitment were not as clear, and so when the grantees started implementing their projects, the partners were like, oh, I guess I didn't realize you were going to want me to do this. Or, oh, I guess I didn't realize that meant we would provide these resources or this staff person or that kind of thing. So we want the letters of commitment to really show that the partners listed in the proposal understand what they're getting themselves into. That does not mean that we would not fund something if the letters of commitment are not clear, but it just gives us an idea of how to help the grantees and say you really need to go back to your partners and make sure they understand what's going to be expected of them. All right, and that is that. I guess, I know I've gotten a couple of questions. Okay. Didn't know if anyone else had any other questions of the Rubric or the process, the timeline, anything like that. Tara, did I forget anything? No? All right. Seeing no questions popping up, I think that is all for today. My contact information is here. Again, we will be sending out this Friday your packet of proposals. We'll be sending out a copy of the guidelines. We'll also include a printed copy of the rubric, just so you can see it if you want to read and take notes offline. We'll include a copy of at least the questions and the guidance. We'll also send you all an email with a link to the proposal rubric online and a copy of the PDF version of the rubric, depending on how you'd like to fill that out. Let's see, cover memo, RFP, rubric, proposals. So expect the proposals sometime next week. If you don't receive them by, say, Thursday, please give me a call and we can find another way to get them to you. When you filled out your proposal reviewer application, we asked people to indicate which address they wanted us to send the proposal to, and that is the address we're going to use. So some people included a work address, some included a home address. So if you aren't sure which one you submitted and you'd like to know that, or if that information has perhaps changed, please let me know by Thursday so we can make sure we get the proposals to you in the right location. Okay. I think that's it. Thank you so much for spending part of your Thursday afternoon, Tuesday afternoon. Tuesday afternoon with us. And I appreciate, again, your assistance in helping us review proposals. And I look forward to seeing all of you in person later on in September when I come around to do the review meeting. If you have any questions, please do not hesitate to call or email me. Thank you.